Today, I'm delighted to be speaking with Clinical Ambassador for the Mouth Cancer Foundation, Tripat Mahajan, in the next of our series of speaker interviews in the run-up to Dentistry Show London. At this year's Dentistry Show London, Tripat will be giving an update on mouth cancer in the Enhanced CPD Theatre on Saturday, the 7th of October at 12:10. So thank you for speaking with me today, Tripat.
Thank you for having me.
No problem. So you'll be giving an update on mouth cancer at Dentistry Show London this year. Can you give us a brief overview of what you'll be covering during your lecture?
Yep, so this lecture is an update, so it's more of a refresher, hopefully, for the dental profession. It will outline the updated facts and figures about mouth cancer, the common risk factors, and how to carry out an effective history and screening. But also it will cover the role of the dental team, the role of the Mouth Cancer Foundation and how that fits into everything, and how dentists and dental practices can engage in building awareness around the disease.
Perfect. And I know that mouth cancer is the 6th most common form of cancer in the UK, and cases are even more common amongst those living in areas of deprivation. So how do you think we can support these communities and raise awareness of the risk factors and symptoms of mouth cancer?
So access to dental care does need to be improved, and that's a whole other thing. But it's important so that patients are able to access the appropriate professional before it's too late. So raising awareness about signs and symptoms and risk factor control can be a practice effort, and it can be included on social media as well. So the more that everyone engages in the conversation, the more the public will increase their knowledge around the topic. But also raising awareness about self-checking. This message is really important because some patients aren't registered with an NHS dentist, not all of them are, and they do still need to know when to ask for help. So advocating for self-checking is really important. And the Mouth Cancer Foundation is a leading UK head and neck cancer charity, and it's dedicated to raising awareness and supporting those that are affected by it. There are self-check videos available online, and also the Mouth Cancer Awareness Walk is happening on the 23rd of September in Hyde Park, and also the walk from home takes place between the 1st of October and 30th of November to include Mouth Cancer Action Month as well. And it's a walk for the dental industry to actually raise awareness about mouth cancer. It's a great way to engage in the conversation and promote in practices and online as well. So that's another thing that people can look out for.
Amazing, yeah, definitely. And in your opinion, what do you think needs to happen generally to reduce the number of cases of mouth cancer in the UK?
So I think that's a tough question. There's so many sort of layers to that, and there's so much to do. But I think primarily, as I said, raising awareness about the signs and symptoms and risk factor control. So smoking and alcohol cessation, for example, raising awareness about HPV and getting adolescents vaccinated, for example, and improving access to NHS dentistry is a very real challenge at the moment. And according to there's the Oral Health Foundation Stage of Mouth Cancer UK report from last year, and they reported that over 50% of mouth cancers are still sadly being diagnosed in their late stages. So that massively affects prognosis. So it does need to be caught early. So I think just improving access is another factor that does need to be considered.
Yeah. And finally, apart from your own speaking session, what else are you looking forward to about attending Dentistry Show London this year?
So I'm really looking forward to attending. I'm an ambassador for the Mouth Cancer Foundation, as you said, and the charity does have a stand on both of the days of the conference. I'm excited to visit that and help out where I can. And I'm really looking forward to just attending and meeting fellow colleagues within our profession. I think it's a great opportunity to catch up with familiar faces, and the other speakers also look really good. So if I can catch a few of the talks, I will.
Amazing. Well, thank you so much for speaking with me today, Tripat. It's been such a pleasure. And I look forward to seeing you at Dentistry Show London in October.
Thank you very much. I look forward to seeing you.